An all-new View starts right now. Grey's Anatomy star Ellen Pompeo talks about teaming up with a real-life doctor who tested positive for COVID-19 to give Americans a wake-up call about staying safe. Here come Hot Topics with Whoopi, Joy Behar, Sunny Hostin, and Meghan McCain. Now, let's get things started.
Hey, welcome back. Grey's Anatomy star Ellen Pompeo has been a vocal supporter of listening to the real-life medical experts about the pandemic, and that's why she enlisted her friend, who's an ER doctor and founder of Cure Urgent Care in New York City, and he also tested positive for the coronavirus. So Ellen joins us now from LA, and Dr. Jake Deutsch joins us from New York. Hello, both of you, and welcome to The View.
Hello.
Hi, thank you.
Hello. You and Dr. Deutsch did an Instagram live video together a few weeks ago to get a message out to young people about what they should be doing. What was your goal with this?
I think just to have, everybody take the stay at home order more seriously.
Dr. Deutsch, you're an ER doctor. You run an urgent care center in New York City, probably in my old neighborhood. Shortly after you filmed the Instagram live video with Ellen, you tested positive for COVID-19. Tell me, what were your symptoms? How bad did it get?
I was quite surprised. I thought getting COVID was actually going to be flu-like. I wanted to almost get it done and get back to treating people. I was surprised at a week that I had pneumonia on both sides, and that's when I checked myself into the ER as a patient. So I actually have a unique perspective because I had quite serious illness that lasted for 2 weeks. Luckily, I didn't need to be hospitalized, but I was dealing with my own illness at the same time, running a very busy practice, seeing people who were testing positive as well. So partnering with Ellen only made sense. We had an acquaintance that we met years ago because she told me that she was a doctor also, and she follows me on Instagram. And so when the message needed to get out there, we partnered up and went live. I think it was Ellen's first live. And we wanted to just connect with the parts of the community that otherwise may not listen to press conferences or really weren't tuning into what was important about staying at home and socially distancing.
Right. And when exactly should someone make the decision to go to the ER, to the hospital? At what point do you think?
Yeah, I mean, I think that there's a critical point when you're having an illness that's so severe that you really feel something's not right. Severe difficulty breathing, uncomfortable pain in your chest that doesn't feel right, low oxygen levels with signs of maybe hypoxia, blue lips. I knew after a week something wasn't right. And, I think that was my indicator. And I think everybody that's pretty sick generally has this gut feeling that says, wait, I need to get help. Of course, the hospitals are overrun with patients and we need to reserve the critical care resources. But when those type of symptoms are presenting, you should think about considering needing hospitalization. But urgent cares are a great alternative. We're seeing a number of patients. We're testing for COVID. We're testing for antibodies. And that allows us to keep people out of the hospital. So knowing your resources, talking with your doctor, telemedicine, listening to Ellen, all of those, I think, have a big role in how we can manage our symptoms and expect how to get treated.
Now, Ellen, your message to everyone is stay at home. But we are seeing protests all around the country with people who are really rallying against their stay-at-home orders and policies. How do you feel about the protests? Because some Americans are just, they're out of work and they're scared about losing their homes.
And that's completely understandable. And listen, in these times, I have to say, they have every right to protest. We have every right to have freedom of speech, and they have every right to protest. So, we have to support those two rights first and foremost, especially during this time. But I think that the dangerous thing, obviously, is people not listening to what all of the governors, I think pretty much today, all of the governors are in accordance. I think even the governor of Georgia has walked back, or is it the mayors? I can't keep track anymore. Have walked back saying that, we can't reopen too soon. And so, I mean, listen, there's always going to be a small fraction, and I think this is what this is, a small fraction of people who are going to go against the science, who are going to go against what the doctors are saying. We don't need more division. We need people coming together. We need everybody listening to the doctors like Dr. Deutsch and the scientists, because they really know what's happening. I would urge everybody to listen to the science, not necessarily the politicians, because I don't think that they have lots of agendas, and the economy being one, and that's very important. And, to the people protesting, the irony is you could reopen your small business, but is anybody going to show up? So, I mean, I think, you have to sort of look at the long game and be intelligent and say, okay, I can be defiant, and I can think this is over dramatized, or I could think it's fear tactics, and I can open up my small business, but is anyone really going to show up? And then, if those people who are so adamant about protesting and so adamant that this is sort of all fear-based, if you get sick, maybe you should just stay home and don't go. You didn't mind putting doctors and nurses at risk, or anyone who works in a hospital for that matter. If you don't mind putting them at risk, then you shouldn't then go ask for their help if you get sick. Hopefully they don't get sick. We don't want anyone to get sick. And if people are looking for work, I love what the governor of New York said, Andrew Cuomo, who's been an incredible source of strength, I think, for everyone during this time. Essential work and essential workers is something probably a lot of states need. So if you really want to go out and don't want to defy the stay-at-home orders, and you need money, perhaps try to research essential work, grocery store workers, Uber drivers, hospital. Maybe you could, do some testing. Maybe there's somewhere you could be of service if you're not afraid of getting sick.
Yes. Dr. Deutsch, we've been hearing a lot about this drug called hydroxychloroquine, or is it chloroquine? I never know. Trump has been promoting this as a possible cure for COVID-19, but studies have shown that this drug hasn't been a benefit and actually leads to a higher rate of death among patients who have COVID. Now, you actually took this drug to help you recover. So talk to us about that. What was your experience like with it, and what is your recommendation going forward? Should someone take this drug even though it's been proven to be harmful? I don't think so.
Well, we're learning day by day new information. And when I was ill, which was at the beginning of March, there was a study that just came out of France that indicated that there was some positive effect. And whether that positive effect was because it worked or those people were going to get better was unclear. It was a small study, but what we were dealing with was the uncertainty. So as we learn more, we're going to be able to understand what's working and what's not. Hydroxychloroquine for myself was indicated because I was really sick with pneumonia on both sides. And also I had a father that was critically ill in the ICU on a ventilator. So I wanted to try whatever was in my best interest to make sure that I didn't get worse. I was really concerned about the family history and expression of this virus. We're learning more. It may not be the solution here, but as we practice medicine, as we learn from each case, then we're going to understand what makes sense. So this may not be the cure, but hopefully we're going to get one step closer to figuring out what that is.
And that's the way to do it. Thanks to both of you, both to you, Ellen, and to you, Dr. Jake. We will be right back.
Thank you.